Why did we choose to have a baby here? Actually ended up with 3 babies here. You know, Shawnee Mission has always been known as a very strong maternity hospital, and it also helped that I was working there.
We've just had many great memories of, or I have, and he continues to have with his delivering here at Shawnee Mission.
Well, I talked with one of the nurses that's been working here, and that's one thing you'll find, is a lot of the nurses have great longevity here at Shawnee Mission. And she even remembered which room you were in for the 3rd delivery.
You're kidding.
You know, that was 15 years ago. And she goes, oh yeah, I remember your wife was in room 277, and you know, that's where you had your 3rd. And I'm like, wow, that's pretty good. That's good. Things that people should know about maternity services, one is that it's a very top priority for this hospital and for the system. And I think the other thing that I hear from a lot of colleagues, patients, other people around, and I don't know if you hear this, but they're usually incredibly impressed with the staff. The motivation, the nurses, you know, they spend more time with the labor nurses and the postpartum nurses than anybody. And, you know, we spend a lot of time with them through their whole prenatal course, but when it comes to labor and delivery, they're really, it's the labor nurse that's with them a lot. And it's not uncommon that you'll see a labor nurse, you know, of course they work shifts, they work their 12-hour shifts, but it's never a surprise. You'll have a nurse that if somebody's getting close to delivery, they'll just stay over. You know, they're not just punching the clock. I mean, it's like, okay, it's 7 o'clock, the shift changes, and they're like, no, I'm going to stay with you till you deliver. And that happens a lot. And, you know, patients pick up on that. You know, or I'll have nurses that'll come in, maybe they checked the patient in the day before, and they didn't maybe get to see them deliver, and they say, well, I'm going to come visit you tomorrow when you're, and they'll go. So I think that's probably the one thing that has really stood out that I would tell people, you know, you can't beat the staff, and the commitment is really special.
You really bond with those labor nurses. You really bond with the labor nurses. And
do you remember your first labor nurse?
And the anesthesia guys I really liked. And gals, yeah, the anesthesia group is top notch.
Michael Magee, obstetrics gynecology here at Shawnee Mission Medical Center.
Sherry Magee, proud mother of 3 boys.